Welcome to Season 1, Episode 16 of the Home Healthcare Today show. I am your host, Dr. Cleamon Moore. It is October. And in October, we focus on several different, very important topics. October is Breast Cancer Awareness Month, but it's also National Physical Therapy Awareness Month. So we are joined today by a very special guest, a physical therapist of close to 40 years, David Sharath. David is the owner and lead physical therapist at Golden Triangle Therapy Incorporated. David, thank you for joining us today.
You're welcome, sir. Thank you. Thank you for having us.
A pleasure, a pleasure. So, David, there's a lot of talk, obviously, about the importance of physical therapy, health, the strength of the neck and the spine. David, tell us a little bit about yourself, your background, and your passion for helping patients in Metro Detroit.
As you mentioned, I'm a PT for quite some time, and my passion to help people is when I see people get better, it's a tremendous motivation for me.
Yes.
To do better, because when on an average, if I see 10 patients per day, at least 8 plus of them feel good.
Yes.
And because when you're doing right stuff such as manual therapy techniques and therapeutic exercises and body mechanics instructions,
Yes.
it's so vital. If you see the human body,
Yes.
everything is movement based. If you look at our eyes, mouth, tongue,
Mhm.
the heart, the joints, everything is moving.
Yes.
And we are created to be movement beings. So as long there is movement, the problems are less. If you see even post-operatively, also they say, get up and walk.
Yes.
Get up and walk. So and that's what I am passionate about, helping people, especially in the Metro Detroit area. In my opinion, Metro Detroit area patients are the best because
Yes.
they're very courteous and they follow the instructions.
Yes.
And it's easy. It's easy to work. So I've been I've been in and out of the home care work also
Yes.
for almost quite 10 years,
Mhm.
and few days a week, few hours. I did in the past, but right now I'm mostly in the in the clinic. So
Wonderful,
that's where I am.
wonderful. Well, thanks, David. David, what goes into a little more about physical therapy? What goes into a physical therapy evaluation in the event that a patient feels as though they're not moving as easily as they would like to, or they're moving with pain? Whether that pain comes from a chronic illness or whether it's a post-operation for a patient. What goes into evaluation and treatment?
Well, see, usually when I'm doing an evaluation, I'm basically trying to. History is very important. I try to
Yes.
find out what is the origin for this problem. Is it because you fell down, or you slip and fell, or you bent down to pick up something,
Yes.
or have you been lying in the bed for a long time because of surgery, or usually these are the case, or some kind of sickness came about, and you've been bedridden for 15, 20 days. Once we
Yes.
figure out the history, then based on that only we start the evaluation process and the treatment. For example, for most of the people that we see, they are elderly people. They got a lot of
Yes.
knee pain, hip pain, and back pain. It's
Right.
very important to screen to see if the knee pain is coming from the back or it's an isolated knee pain, or the hip pain is an isolated hip pain, or it is coming from the back. Once we figure that out, it's easy to fix. Sometimes we are working on the back, but whereas it's the hip.
Yes.
Here, for example, they might need some hip quadrant mobs, and you fix that, and there are different glides, like a C glide,
Yes.
or like a plus glide is there. You glide that, range of motion comes, and patient is able to walk better.
Wonderful.
Same thing with the knees. When
Yes.
if you find out it's because of the knee, so most of the people have a patellar tendinitis. And that's what it is. You work on that, and they're able to walk, and it's very important for people to recognize that they got to move. You got to do
Yes.
something, and
Yes.
that's the way to go.
Gotta move.
You gotta move. You
Gotta
gotta
keep it
move.
moving,
Got
right?
to move.
Yes.
And that's what goes into evaluation. Of course, I've been just kind of keeping it brief and simple.
Sure, David.
So it's a little bit more than that, but this is just generally that's what happens. So.
Okay, thank you, David. Granted, it's Physical Therapy Awareness Month nationally, and you've been at it for close to 40 years, 37 to be exact. How do we encourage more youth to pursue physical therapy? Because we also want to talk to some of the students out there and make them aware that physical therapy is a great career to get into, to be able to be of greater assistance to some of the elderly individuals in our community.
20 years ago, they used to say by 2020, we'll have so many baby boomers retiring and all the stuff. I used to hear, and it used to be a long time. Now 20 years has passed, and we're 2021 now.
Yes.
And, a lot of people need help. Our baby boomers who worked hard to make what we are in America, they need help. And physical therapy is a great profession because you see results. Otherwise, I won't be in this profession for 37 years.
Right.
When people get better from whatever the problems they are, and it's a great occupation, and a lot of demand for physical therapy. You yourself know that you are looking for PTs, and they're not there much there. So it's a great occupation if you want to help people and make a difference in our country. So,
Wonderful. One more question, David, prior to going to a commercial. 37 years, we want to encourage young people or even older people that are changing careers, that are looking to go into health science or looking to go into PT, to pursue this as a career path. What were some of your challenges or obstacles along the way, David, as you created a successful business, a successful career, and as you have helped thousands of patients here in Dearborn and Metro Detroit, Southeast Michigan? Some of the obstacles and challenges, and how did you overcome them?
To me, obviously, finances was a big problem.
Yes.
And going into school and paying off all this, school loans and stuff like that. So, having said that, that's especially it's in America. It's easy to get student loans and stuff like that. I don't think if you put your heart to it, and if you put the hard work, and if you're willing to study, and if you're disciplined, it's doable. And what I realized is consistency is very important. And there were many downtimes in my life, where it was tough. But I realized I got to do this consistently and passionately, and people see that you care for them.
Yes.
And then the word of mouth goes out, and then
Sure does.
before you know, it's there, because I have generations of families who are my patients.
Yes.
And so those are the
Wonderful.
things that you got to be consistent, and you must love what you're doing.
Absolutely.
So.
Very nice. Very nice. That's a perfect segue for us, David. We were a sponsor this year. American Advantage Home Care was a sponsor of WDIV Channel 4's Health Week. So just in case you missed that segment where we were on live in a D last week on Channel 4, discussing not only National Physical Therapy Awareness Month, but we also highlighted our agency, American Advantage Home Care, as we look to reach out and support more patients in Metro Detroit. We're going to flash back to last week, and after that segment, we're going to continue our conversation with David Sharath of Golden Triangle Therapy Incorporated. We'll be right back.
It's Live in the D Health Week. All week long, we are helping you navigate through those health challenges you may encounter, whether it's questions about your own health or caring for a loved one. And you have the chance to win $500 that could help along the way. And it's made possible by these sponsors. Now, one of the most unexpected challenges can be preparing for and getting health care assistance at home. For guidance, we are joined by Dr. Cleamon, President and CEO of our sponsor, American Advantage Home Care. Thank you for being with us.
My pleasure. Thank you for having me, Todd.
Well, it is a pleasure to have you as well. Now, tell us more about your company.
Yeah, so American Advantage Home Care Incorporated is a Medicare certified provider of skilled home health care services. So we offer skilled nursing, physical therapy, occupational therapy, medical social work, and home health aid assistance, all under physician's orders to homebound patients all throughout Metro Detroit. And we've been doing it since 2012.
Okay, but now how can people tell that it may be time to get healthcare assistance in the comfort of their own homes?
Well, that is a great question. So, if a person is planning an elective surgery from a hospital and they'll be discharged and believe that they'll need some assistance once they get home, they can begin to identify home health care providers. And we don't only serve patients who are being discharged from the hospital. If a person has a chronic illness or if they're referred by their physician for assistance with medication management, adapting to new devices such as walkers, canes, and power wheelchairs, we're able to assist there as well. So there are a number of different ways that a person can identify the opportunity to be served by a skilled clinician in the comfort of their own home, and their insurance plan will most likely cover those fees.
Okay, so how quickly can you start working with new patients?
Yeah, so when we get a referral, we're able to go out and see a patient within 24 to 48 hours of seeing that referral. A registered nurse and or a physical therapist would go out and do a skilled observation and an assessment of what that patient's care needs or what their care plan should look like. There'll be some teaching and training of that patient and their caregiver. And that skilled clinician will begin not only after the assessment, but will begin applying technical skills. So if there's wound care, if there's ostomy care, we could do it immediately within 24 to 48 hours of receiving a referral.
Okay.
And granted that this is, yeah.
Yeah, and how do patients make arrangements to receive this help in their homes? How do they reach out to you?
Yeah, so awesome. So patients can call our number. In fact, patients are calling now. They could call us at 313 914 2296. Their doctor could also send a referral via fax to us, and we also take referrals via email.
All right. There's such great information and easy to get in contact with you. Clearly, the phones are ringing off the hook already, which is a good thing.
Absolutely. Yes. It's National Physical Therapy Awareness Month. So we're really busy out there working on patients in Metro Detroit.
Well, that is always a good thing. Doctor, thank you so much for joining us this morning.
My pleasure, Toddy. Thank you for having me.
To learn more about American Advantage Home Care and how they may help you or a loved one at home, visit the website AmericanAdvantageHHC.com.
Welcome back to Season 1, Episode 16 of the Home Healthcare Today show. We are sitting here with physical therapist David Sharath of the Golden Triangle Therapy Incorporated, located in Dearborn, Michigan, 4241 Maple Street. So, David, we were having good conversation prior to our break about loving our patients, caring for them, being passionate, fighting to get through obstacles. And as we all know, COVID-19 has been a tremendous obstacle and challenge for families here in Detroit and around the country, better yet, around the world. David, how could physical therapy be of assistance to patients who are recovering from COVID-19?
I've been seeing quite a few patients post-COVID.
Yes.
One of the things that I noticed is their activity tolerance level is quite low because of what it does to your cardiopulmonary system.
Yes.
And so what we have been doing is start slow and do a few things like breathing exercises and some little bit of bike and a little bit of low intensity aerobic exercises and some general strengthening exercises, not a heavy duty strengthening exercises because they get tired very easily. And those are the kind of things that we have been doing it and encouraging them to take walks inside the house.
Okay.
And I generally, for post-COVID recovery patients, I'm telling them at least take 5,000 steps per day.
Wow. Yes.
Especially if they are the younger ones. The older population, at least I recommend them at least 2 to 3,000 steps, and I tell them to breathe, take a deep breath for 2 or 3 steps,
Yes.
and exhale for 3 to 5 steps, and it's all doable.
Absolutely.
And a lot of people, especially these patients, think that they got to go to a gym or physical therapy office. It's not true. In the comfort, especially for the homeborn patients,
Yes.
in the comfort of their home, you can get 5,000 steps if you're diligent and if you're willing to walk
Yes.
for 25 to 30 minutes.
Absolutely, David. And David, that's the next question where we were headed. As a home health care agency, we're American Advantage Home Care, and that's how you and I first met, as tenants here in the same medical building. And you were able to actually go out and see some of our homebound patients and refer patients to us, and that we appreciate. And we like to also refer patients to your clinic, the ones that have gone through in-home physical therapy and are in good position for outpatient. With that being the opener to this question, David, what are some of those benefits for families to get in-home physical therapy to help them to rehabilitate or recuperate faster?
So immediately when they come home from, especially let's say a knee replacement or hip replacement or early back, neck, or even general surgery patients,
Yes.
they go home. It's very absolutely important to have home health physical therapy, for that matter, home health services, including the nursing and other services. It's so important because when we get to the people's home, we help them to get up and move, and having the knowledge being a medical professionals, we understand what it takes to take care of the sutures for a knee replacement or hip replacement or a back, the weight bearing status or non-weight bearing or partial weight bearing status, or different precautions, how to hold the sutures to cough and
Right.
stuff like that, and if you have a swelling, how to elevate your legs
Yes.
and all those kind of things and movement. And we being there for 45 minutes to 1 hour, help them to encouraging them to do all those things and assessing their home and seeing what they have in their homes, use that as a means to help them to use that rather than a lot of people think that they need dumbbells. They need a can of beans is more than enough, or a gallon of milk
or
is
water.
those kind of things are enough. Or if they have 2-3 steps, go
Yes.
up and down the steps.
Absolutely.
And especially climbing stairs is a big problem because most of the seniors have an issue with the balance.
Yes.
A little bit of balance exercises.
Yes.
It'll go a long way. I noticed that, and
Okay.
and these are the kind of things. And plus, if we bring the world-class orthopedic skills into your house. For
Yes.
example, a patient, somebody has got a surgery, but they're unable, let's say abdominal surgery, but they
Yes.
have capsulitis,
Right.
unable to reach back to
Yes.
something. We can not only take care of the general physical therapy associated with the post-surgical recovery, we take care of the shoulder by doing inferior glides and so many other things, manual therapy stuff to do, to move the shoulder.
Yes.
And the patient is like this, before you know, there's like this, and then they're able to reach back, and it goes a long way, believe me.
Sure does.
So those kind of things, we just not only coming there saying, okay, I'm here to take care of the post-surgery, we just do a general assessment, like I said in the beginning,
Yes.
and meet the other needs of the patient also.
This is very helpful, David. It really is for families out there listening, because the eval and training oftentimes extends to caregivers and family members to assist that patient once the therapist leaves or in between therapy visits to keep the motions going and to keep them going correctly. And you mentioned the fear of can I sneeze, or when I sneeze, or if I cough, how do I keep my abdomen muscles tight or close, right? That is very helpful. And a lot of times families don't think about it until they're in that situation, David. So very good work there. One important question that we didn't cover that families think about a lot, especially during this season, David, is falls and fall prevention. What are some ways that physical therapy can help either in-home or in a clinic such as this, an outpatient clinic? How can we help patients with balance and to prevent or decrease the risk of falling?
See, as we were talking earlier,
Yes.
Loss of balance, usually when it hits 65, 70, the proprioceptive reflexes become less, so patients have more tendency to fall. And coming back from the hospital because of the post-anesthesia, post-surgical, they may have a knee weakness or hip weakness, quadriceps or gluteal muscle weakness those weakness can cause you to trip and to just general fall. And also because of lying down in the bed, sometimes they can develop simple inner ear issues of labyrinthine stuff, and all these things. It's a combination. So we got to do the assessment to find out where the things are coming, and then address that specifically. And sometimes what happens is when they lie down and they get up, the head starts spinning. This is very common things that you see with the patients, and those are the things we assess and see whether this particular patient will need a balance training associated with therapy, or just general strengthening so they won't trip and fall. And also another important precaution that we do a thorough home assessment to see if there are any carpets or there are any chairs or any other things,
the
rugs or any of the toys, the dog, things that are there in their house, and give them specific instructions. And that goes a long way. Especially we train the home health aide and also the family members to know with regard to precaution, because sometimes people ask, what is toe touch weight bearing? How much? How much is that? Is it 10%, 50%, and all? So it's so those kind of things, and also tell the patients that don't fear that just putting a little bit of weight you're not going to trip and fall, and
absolutely.
So those kind of things, So
wonderful, David. You have been so insightful and informative. You got a full-scale clinic here with all the equipment. You have patients here and patients waiting in the lobby. So we don't want to take up more of your time. Last question, David. Are there any additional resources or clinics that you would recommend for patients in Southeastern Michigan besides American Advantage Home Care and Golden Triangle? Is there anything else out there for listeners and viewers?
So there is Max Rehab Clinic. It's a fantastic. I have a couple of my friends working there. And there's one additional one in Dearborn. There's one in Madison Heights. There's one in Troy.
Wonderful.
And one in Southfield. These are this is a good place that I know of. Where I strongly recommend. And of course, Dr. Cleamon, you're very passionate. I'm so privileged that from time to time I get to work for you.
Yes, indeed.
Sir, and yours is a fantastic home health care organization.
Thank you, sir.
I wish I had more time to work for you. And I know you care for your patients. I know you, sir. I know. I've been to your office. You care for that. And thank you for hosting me and making the effort to bring the awareness in the community. Thank you.
Absolutely. Thank you, David. All right, folks, wrapping up here, Season 1, Episode 16. Keep Dr. or physical therapist David Sharath and Golden Triangle Therapy Incorporated in mind. Thank you.